today, when I'm out talking about health care, because nobody knows zip about the tax code, I say, folks, are you aware that if you're a really successful fella and you want to get a designer smile put on your face and your company has got a really rich benefit package, you can get it and you can write off the cost of your designer smile on your taxes. But if you're a low-income woman who's working in a furniture store and the company doesn't have a health plan there, not only do you get nothing, your federal tax dollar goes to subsidize Mr. Designer Smile. And people practically fall off their chair. They go, why hadn't anybody told me about that? What a ripoff! Off with their heads. Well, what we've said, Senator Bennett and I, is this is a free country, thank goodness. You can go out and buy anything you want. You can buy 3 designer smiles if you want, but you're not going to get a taxpayer subsidy for your designer smile. So in effect, what we do is move the tax code away from those kinds of services and say we're going to use those dollars so that everybody is going to be able to get a basic package. Not going to be a Cadillac package, but it's prevention and outpatient and inpatient and catastrophic. And of course you can buy more, but everybody is going to get a basic package. And the Congressional Budget Office and the people at Lewin have both scored the Bennett-Wyden effort, and both of them have said that for the amount of money we're spending today, everybody in our country can get access to a basic benefit package. The last part is the politics. And my hope is, and several of you kind of touched on this, that people like yourselves can help people see what the alternatives are very quickly. For example, we had this discussion about bold versus incremental. The incremental steps that the Congress is going to talk about next January, Senator Bennett and I will be faced with, are virtually all things that everybody in this room will be for. Expansion of electronic medical records, better coordination of chronic care, improvements in comparative effectiveness analysis so that you can look at what one particular treatment offers versus another, preventive care. Virtually all of these steps will be things that people in this room, and certainly myself and the 17 senators, will be for if you look at them in isolation. But if you're going to be serious, as CED is, with their groundbreaking proposal, being willing to stick their neck out and go first, you've really got to realign the incentives. And that means modernizing the employer-employee relationship. It means taking the $246 billion, that's what the Joint Committee on Taxation says, goes out the door through this tax system. A tax system that was set up in the days when most people went to work at one place, stayed put for 20 years until you gave them a gold watch and a big old steak dinner for retirement. That's now given way to an economy where the typical worker changes their job 11 times by the time they're 40. So it's an economic issue. Matt talked about defeating communism, absolutely, in terms of national security. But if we can go out with the leadership of CED and talk about healthcare as an economic issue with social implications, not primarily a social welfare issue where economics comes in as an afterthought, but as an economic issue with social implications, I think we're up to it this time. You know, when you're talking about the United States Congress, I guess Bob and I often talk about it, you should always bet on inaction. That is certainly the case after 60 years of going back at this since Harry Truman in 1945. I think as a result today of the economic challenges, and particularly our companies needing to be competitive in tough global markets, I think there's an intersection between financial services, energy, and healthcare, and a willingness to recognize that if you don't get the healthcare part of this right, you can't make our companies competitive in global markets. And with that, I want to yield my time to the best possible partner in the United States Senate, a member of the Republican leadership. To give you an idea how credible Senator Bob Bennett is, he is very much admired by both Harry Reid and Mitch McConnell. And that tells you about his credibility in the United States Senate. My friend and my partner, Senator Bob Bennett.